working with the vendor quite urgently to get the missing shipment here very soon.
A call to delay non-urgent blood testing in Alberta due to a medical supply shortage. It's not the first supply issue our health systems have encountered during the pandemic, and it won't be the last. And it has some experts calling for a greater digital infrastructure supply chain in Canada.
One of the tube types we use for collecting blood on patients is called an EDTA tube. Is in extremely short supply at the moment.
One of AHS's shipments didn't come through, and while they're working to secure these vials from another source, they're being extra cautious with the vials they do have.
So we can divert the finite resources into our acute care settings.
Well, Dr. O'Hara assures Albertans that anyone who needs a blood test will get it. This isn't the first time our system dealt with supply chain issues.
We had PPE shortages, which were resolved when we were first doing COVID testing in our laboratories. We had reagent shortages, equipment shortages. You know, it's kind of been one thing after another.
The truth is this supply chain for health systems was always pretty fragile.
Ann Snowden of the Supply Chain Advancement Network in Health says no country can be fully self-reliant when it comes to medicine and medical supplies, which means the key is being able to track supply.
I'm not sure if we're any worse off than other countries, but we are certainly not leading, is digital infrastructure.
Snowden says that Alberta is actually ahead of the curve in Canada on that digital front.
That exceptional digital infrastructure doesn't reach to every corner of every lab.
Meantime, Dr. O'Hara believes it should be just a few days before these vials are in the warehouse. But
next week, it could be something else. But we're very well prepared. We have really good procurement folks that are going to bat for Albertans every day.
In Calgary, Tara Overholt, City News.